The next question is, if there were a case where you wouldn't remove endometriosis, then would you refer to the appropriate surgeon to do so? It's the mark of a good surgeon who knows the limitations of their skills and is able to know when the patient requires a higher level of care. The next question is, what is the aftercare plan and pain management plan? So this is something I go into quite a bit of detail with my patients at their preoperative appointment. So the purpose of the preoperative appointment is to, number one, review the planned surgical procedure. I always confirm that with the patient. Number two, we of course review the risks of the procedure. We review expectations. So what can we expect as we recover, and what can we expect from this surgery as far as a clinical outcome? I also go through how to prepare for surgery. Surgery is a very physically intense process. And so doing some what we might refer to as prehabilitation or preparing the body for surgery is important. We're talking about things like making sure that you're eating a diet that's rich in protein to make sure that you have all the building blocks necessary for you to heal appropriately after surgery. And we also discuss logistics. What can we expect? We're probably going to get a phone call from the hospital. We will get a phone call from the hospital before surgery to go over instructions, when to arrive, what medications to take, what medications to hold, etc. And so I think investing this time into preparing for surgery really helps patients have better outcomes. They know what they're up against and they know what to expect, which is very important. The next question is, when will I have a follow-up appointment? Speaking from my perspective, I see most patients anywhere between usually a week or two after surgery. And that postoperative appointment is where we can have a formal check-in, see how the patient has been recovering. We will go over the operative report. We will go over the pathology report. We will go over pictures from surgery so that I can show you what we found at the time of surgery. And we'll discuss next steps or future steps in your care plan and what needs to happen from here on out. With surgery and with setting expectations, it's very important to understand that more than likely, if you're a patient seeking care for pelvic pain and endometriosis, it has probably been months and years that you have been feeling the symptoms that you've been feeling. So it's very important to have a realistic expectation that a couple hour long surgery is unlikely to undo years of symptoms and disease that has been at play in your particular case. So I encourage patients to think of surgery more like a new beginning, kind of like a new fresh starting point, but more than likely they're probably going to have to be treating other pain generators. They might have to see other consultant physicians for that treatment. They might have to do physical therapy. They may have to take medications. They may need to have other interventions to help optimize their pain control after surgery.